Thank you very much indeed, Grady. Now, I want to bring in Wyoming Senator John Barrasso. He is with us this morning, a Republican from Wyoming. Sir, you're a doctor. Well,
yes, sir.
You were a practicing doctor before you went into the Senate, and I'm sure you're still a doctor now. Won't restricting vaping hurt those people who smoke tobacco, hurt them when they try to quit smoking by using these vaping devices? You don't want to go too far with clamping down on vaping, do you?
Well, my concern, Stuart, are young people and the people that have recently been hospitalized. There are 5 million young people, about a quarter of all high school students, who have taken up vaping, and these are folks who have never smoked in the first place. They're becoming addictive because the amount of nicotine in just one of the little pods equals a full pack of cigarettes. Additionally, what these companies are doing is targeting these young people to take this up and become addicted because of the flavors. Chocolate chip, bubble gum, juicy watermelon. Those are flavors used to entice young people. That's my concern from a public health standpoint and from an addiction standpoint.
Can I just throw this at you, Mr. Senator? Supposing you could only get a vaping device with a doctor's prescription. I know that's kind of radical stuff, but wouldn't that solve the problem?
Well, I think that would certainly help in terms of a smoking cessation device for people that are already smokers. You want to get them away from the cancer-causing chemicals in the tobacco, and if you can get them to something else as a transition to quitting completely, I think that would be better. A prescription may be the way to go. My focus is on the young people and the people who are now showing up in emergency rooms with all of these incredible, what is called acute respiratory distress syndrome. The total cause is not known.
I think many parents are very concerned about this, Mr. Senator. Now, you have an article in the Washington Examiner, and it reads, "The 2020 Democratic Agenda, Take Away Your Work-Based Health Care." And you don't want that to happen, and understandably. Healthcare, workplace-based healthcare is a very good thing for millions of Americans. But there's a debate tonight. Would you expect any of the Democrats, you're laughing, would you expect any of the Democrats on the stage to walk back their support for ending private health insurance?
No, I think the Democrats are all in on taking away health insurance from 180 million Americans who get it through work. Their goal is a one-size-fits-all health care plan where people will pay more to wait longer for less care. And what we also know is they're all going to want to give health care to illegal immigrants, people who are here in the country illegally. At the earlier debate, every hand went up when said who would give health insurance to illegal immigrants. Well, who's going to pay for that? The American taxpayers who the Democrat candidates want to take health insurance away from. It is astonishing.
I think you've got a very good election issue there. The idea that you take away the health care of 100 million Americans and force them into something else. I just don't think that's a winner. But that, again, is my opinion, Mr. Senator, and we always welcome you on this program. Thank you, sir.
Thank you, Stuart.
Sure thing.